This time there has been some confusion over the comments from Professor Sharon Peacock, who's from Public Health England, suggesting that trials, this is for the antibody test, this is to discover whether you have had it, have had coronavirus. She suggested that the trials should be completed this week, that the orders are coming in and could be available on Amazon and other places very shortly, and then it appeared to be a slightly different message coming from the government itself. So can you just clarify the situation?
Yeah, so there's two types of tests. There's the test that we are rolling out. We've done 97,000 of them already, one of the highest numbers in Europe of have you got it, the swab test. That's been done, and we're ramping that testing up from 5,000 to 10,000 to 25,000 and ultimately to 250,000 a day to make sure that we can get that to our frontline staff and also to others who crucially need it, those who are very ill in hospital. So we're ramping that up. Then there's the second test you're referring to, which is the antibody test, which is, have you got the antibodies? Have you had it? Have you got the antibodies? There's a lot of research being done on that. Some of the best brains, not only in this country, but in the world, are working on developing that test. You've heard from the scientists that good progress is being made. They're testing it. They're moving forward with that. But I don't want to be premature in setting a specific date when it'll be ready. We heard the chief medical officer, and we've seen in the press this morning some very positive stories reflecting the ambition for that and where we might get to. But the CMO was very clear yesterday, and I think it's important we remember his comment saying, we've got to get this right. A bad test that didn't actually do what we thought it did would be worse than no test at all, because it could provide a false sense of confidence. We've got to make sure that the testing is rigorous and that this does exactly what we expect it to do scientifically before we roll it out. We're doing that as fast as we can. I'm not a scientist, but I know that the scientists who are working on this are doing it as fast as they can, but they're not going to cut corners. They've got to make sure it works. So we're hopeful we will be able to do it very quickly, but I don't want to set an artificial timeline on the science and the work that they're doing.
Can I ask you about we're expecting an announcement from the Chancellor later on, and I'm not expecting you to comment directly on that, but you'll be well aware that a lot of self-employed people have been struggling with, on the one hand, the feeling that they need to go to work to earn money because they don't have the safety blanket that staff employees do at present, whilst thinking, should I be going out? I should be at home. What's your message to those people this morning ahead of those announcements?
Yeah, so my message is the headline message, which we've heard the Prime Minister say, we've heard the Chief Medical Officer and my boss, the Health Secretary, say, which is the key message to everyone is stay at home, protect the NHS and save lives. And we set up very clearly within the guidance, there are only 4 very narrow exceptions to why you shouldn't be staying at home and following that advice. Now, the self-employed, I know that the Chancellor has already set out a significant, a huge package of support for businesses and individuals. But understandably, and I totally understand this, and I've had constituents writing to me saying, I'm self-employed, what does this mean for me? I totally understand that that group, those people are concerned. They are, in many ways, the bedrock of our economy, and we owe them our support. It's a bit more complicated in putting that support package together compared with someone on PAYE, because of the complex nature often of someone who's self-employed business arrangements and the way they set up their business. But I know that the Chancellor has been very clear, and the Prime Minister was, he values hugely their commitment. We don't want to let the perfect be the enemy of the good. We need to come up with a package that will support them. I don't want to preempt what he's going to say, but as you will have heard the Prime Minister say yesterday, the Chancellor will be making an announcement later today about support for that hugely important group of people in our country.
Are you confident, Mr. Argar, and I appreciate the Chancellor will make the formal announcements, but do you have confidence, judging from what you've heard from the Chancellor so far, that some of those people, everyone's seen the pictures of the packed tubes, and these are people who presumably don't want to be in that scenario, feel they have to be. Do you feel confident that some of those people at least will be able to make the right decision along the guidelines you've said, and that will possibly change some of those situations?
Well, there's 2 things here. Firstly, no one should be having to make a choice between what is the right health advice, both for them, but the public health advice to save lives by staying at home, and the understandable need for them to provide for their family and meet their financial obligations. The Chancellor and I spoke over the weekend about other things, but a number of things. But I know that in the context that I know how much he values the work and the contribution of the self-employed. I know that later today he will be making his announcement. As I say, you wouldn't expect me to prejudge it, but I do know that he recognises the need to help and support the self-employed. Now, you mentioned the tube there. I think, yes, it's important that fewer people travel because they follow the advice. It's also important, and I know that my colleague, the Transport Secretary, is working with TfL and the Mayor to make sure as well that there is, for those who do have to travel, there's sufficient capacity on the tube services and on buses to make sure that people aren't all in a small number of them and therefore not able to socially distance if they do have to travel. That's an ongoing conversation.
Really appreciate your time this morning. Thank you very much. Edward Argar, who is the Health Minister, speaking to us this morning. Thank you.
Every day on breakfast, we're going to be trying to get a government voice to try to keep you up to date with the issues that matter when it comes to coronavirus. It has disrupted so many huge events this year. This week, the greatest show on earth, the Olympic Games, it's been postponed.
It's because Tokyo Games were due to start in July. They'll now take place next year.